All right, let's dive into the incredibly high stakes, super high pressure world of emergency medical response. When first responders show up to a scene, it can look like pure chaos. But underneath all of that, there's this really deep, really structured process that every single one of them learns. So let's break down how they do it. I mean, really think about it for a second. The lights are flashing, the pressure is immense, someone's life is literally on the line. How in the world do they cut through all that noise and just know where to even start? Well, it's not magic, and they're definitely not just winging it. It's a protocol, sure, but it's so much more than that. And that is the secret sauce. They aren't just running down a checklist. From the second they arrive, they start piecing together a story, the patient's story. Every single thing they do is like another sentence, another paragraph, in a narrative that could literally save that person's life. And look, this whole story idea isn't just a nice little metaphor I came up with. It's a concept that's actually baked right into the official procedures that guide paramedics and EMTs every single day out in the field. Now, what's so cool about this slide is that this is a direct quote from a universal care protocol. It's explicitly telling responders to think of their patient care report, that's the official record of the call, as a story. And framing it that way is absolutely crucial because a good story has to make sense from the beginning to the middle to the end. And that's maybe the most important part. The story has to be complete. See, when that patient gets to the hospital, another medical professional, a nurse, a doctor who has never met this person, needs to be able to pick up that story and, in an instant, understand the entire journey. What was the problem? What did you find? What did you do about it? And crucially, how did the patient react? It all has to be there to make sure the care is seamless. Okay, so every story needs a beginning, right? And in emergency care, that opening chapter is everything. It's called the primary survey, and its one and only job is to find and fix the things that will kill your patient in the next few minutes. It's that serious. This is the famous ABCD approach. And it's a super simple step-by-step progression for a reason. You can't breathe if you don't have an airway, right? And your heart's not much good if you're not breathing. For disability, they use these quick scales to figure out a patient's level of consciousness. The whole system is designed to make sure responders hit the biggest threats first. It sets the stage for the entire rest of the patient's story. All right, so once those immediate gonna die right now threats are taken care of, the story can start to get fleshed out. The responder kind of turns into a detective, looking for clues and adding all those crucial details. This part is called the secondary survey. And this is just one of the brilliant little tools they use, the sample mnemonic. It's just a simple but really powerful way to quickly get a patient's background. It's basically a cheat sheet for a conversation to fill in the backstory. What are you feeling? Are you allergic to anything? What kind of meds are you on? This is how you build a quick, accurate character profile for the patient. So on top of getting the patient's personal history, responders are gathering all the hard data. Vital signs, blood sugar, temperature. Every one of these numbers is another piece of the puzzle, another little detail that makes the whole story clearer. They'll even dig into the patient's pain, using another tool to understand how it started, what it feels like, and when. All clues pointing toward a final diagnosis. Okay, now this is where things get really interesting, because a good storyteller knows their audience, right? And a good first responder knows that not every patient's story follows the same exact plot. You have to know how to adapt the narrative. Just take this one number, a systolic blood pressure that drops below 90. In the patient story, that is a massive plot twist. It's a huge red flag that screams something is critically wrong. Maybe it's the heart, maybe they're bleeding somewhere, maybe it's a crazy infection. But that one number can totally change the direction of the whole story. And the plot twists just keep coming. The classic story of a heart attack involves crushing chest pain, right? Well, for a diabetic patient or for a woman, the story might look totally different. It might just show up as general weakness or fatigue. A good responder has to know these alternate storylines so they don't miss a huge, life-threatening diagnosis. And of course, the main character's age changes the story dramatically. For an elderly patient, what looks like a minor fall could actually be catastrophic. And you can't just write off their confusion as dementia. It could be a stroke. Then, for a child, the whole assessment starts before you even lay a hand on them, using something called the pediatric assessment triangle to get a read on them from a distance, hopefully while keeping them calm with a parent nearby. Two totally different characters, two totally different approaches. And here we are at the final and maybe most important piece of this whole puzzle. A patient's story isn't written in stone the second the responder figures it out, because patients change, conditions evolve. The story is a living, breathing document. This table really shows you how that story is constantly being reread and edited. If a patient is unstable, their story is getting checked for new chapters and plot twists every 5 minutes. Vitals retaken, treatments rechecked. For a stable patient, it's every 15. It's a process of just constant vigilance. So what this really means is they are constantly asking themselves, has the plot changed? Is the treatment we're giving actually working? Is there a new twist that I need to deal with right now? It's this dynamic process that makes sure the care they're giving is always relevant to how the patient is doing in that exact moment. And that brings us right back to where we started. This entire process, from that first ABC check all the way to the final report they give the hospital nurse, is one continuous act of storytelling. It's a structured, disciplined, and really deeply human way of building a narrative that can make all the difference. So the next time you see an ambulance or see first responders at work, you won't just see them going through a checklist. You'll see an author, a detective, and a historian all rolled into one, writing the most important story of someone's day. And it makes you wonder, what part of that whole story is the most surprising to you?